And joining us now to talk and discuss some new questions raised about the J&J vaccine is Dr. Virginia Bielek. She is the chief of the Division of Infectious Diseases at the Hospital of Central Connecticut. Dr. Bielek, always good to have you with us.
Great to be here again.
So unfortunately, we're learning J&J vaccine being linked to another issue. What do you make of this breaking news?
First of all, these are preliminary reports, and the CDC says about 60 to 120 people get Guillain-Barré every week. So it's a little hard to tease out how many of these cases were actually due to the vaccine, although the timing is suggestive. What I learned from this is how effective the reporting system is. These vaccines have only been available for several months, and we are learning so much about them in such a short period of time because of how the CDC and the FDA are soliciting adverse effects or anything you think might be an adverse effect to the vaccine. So I think what it tells us is the system is working.
Obviously, many people across the country, including right here in Connecticut, received the J&J vaccine. If someone watching right now is one of those people, what do they need to know? Obviously, this news would, naturally make them a little bit apprehensive.
And that's understandable. My understanding, and again, the data are all preliminary, are that the cases of Guillain-Barré come on within usually 2 weeks after vaccination. So if it's been more than 2 or 3 weeks following your vaccine, you're probably going to be okay. And if you start to develop any weakness in your arms or your legs or the muscles of your face, seek medical care, because Guillain-Barré can be treated and usually resolves. Some people will have some lingering neurologic effects, but most of the patients get better. So don't be afraid to seek medical treatment if you are concerned and it's the right time.
You always have a natural way of calming us down when we learn this new news. Lastly, doctor, I want to ask you about Pfizer. The company's suggesting we may need a third shot, a booster shot. Where do you think we stand with boosters right now?
I think while the CDC and the FDA are going to listen to this Pfizer data, I think all of our recommendations will be coming from the national authorities at the FDA and the CDC. So I'm waiting to hear what they say.
Any idea on any guidance on when we might have to get a potential booster shot or third shot, or TBD on that?
I think it's too early to be determined. I'm following the news, interested in what the FDA and the CDC says, but we just don't have the answer to that yet.
All right. Well, we know you'll be following it closely, as will we. We always appreciate your medical expertise, Dr. Bielek. Thank you so much, as always, for being with us.